my little attempt at secure cognition, and because um, this time of year, you might have noticed my content went down because this is when I'm busiest at work, and I wanted to take the opportunity to kind of help people um, understand what's going on because it is open enrollment period for health insurance. Um, and hopefully, people will find this interesting. I just jotted down some notes. If you have questions, please, please, please feel free to call me, comment, come on the Discord, whatever. I'm here. Um, so feel free. I mean, there's all kinds of people who are constantly calling me and getting all kinds of advice, um, who aren't involved in this community we're trying to have here. So, just a few things. So, as far as talking to an agent, I think it is really important to make clear you will have an easier time learning biblical Hebrew than you will reading the information regarding your health insurance choices and understanding what's going on. Please, please, please believe me. I am not, I'm certainly not trying to insult your intelligence. Um, you could spend the next 2 weeks, honestly, full time studying insurance, and I can assure you it would be very, very difficult for you to figure out what's going on. Simply reading the materials that are available is not going to help you really understand that which is most important. And now I'm remembering all kinds of stuff I didn't even put in my notes that I want to talk about. But first thing to understand, health insurance generally, what you can depend on is that for adults, it's about the value of health insurance is about $10 per year of age per month. So let's say you're 30 years old, you're looking at something like $300 a month. If you're 60 years old, you're looking for something like $600 a month. For children, it's always going to be at least $200 a month if you're paying full price. And you can pay full price, you can buy it yourself now. It's not something to worry about. A lot of people, you know, you are worried about, well, if I lose my job or I quit my job, will I be able to get insurance? Yes, you will be able to get insurance. Just understand how much it's going to cost, and that's a really rough rule of thumb. Actually, for people who are younger, it's a little bit less than $10. For people who are older, between the ages of 60 and 65, 65 is when almost everybody becomes eligible for Medicare. That you're those are going to be the most expensive years. It is not uncommon to be spending $1,000 a month just on health insurance um, when you're 64 years old. I have clients spending closer to $2,000 a month. So that's just the basic understanding of it. Um, the number one number you want to look at is not your deductible, but your out of pocket maximum. That's that's what you want to look at. The deductible, yes, everybody's been trained to look at the deductible. Look at the out of pocket maximum. That's really the financial protection that you are absolutely buying with your health insurance. Again, I could say so many different things. We could be here for hours. I'm just going over the most simple stuff so that you have some sort of idea. But if I could fit everything into even a few videos, I would. Um, Really, it is so complex that you should talk to an insurance broker slash agent. Um, in California, insurance agents cannot charge you um, for health insurance at all. So at least in California and in most states, you can get free help. It's just a matter of finding somebody you can trust who's not going to be motivated by their own interest, but who's going to feel an obligation to help you. Um, Life insurance. If you have people who are dependent on your income, you should buy life insurance. If you have little children, if you have a wife at home, if uh, if people are dependent upon you, then it's really, really important to buy life insurance, and it's really, really cheap. Term insurance is dirt cheap. So it, I highly recommend anybody, if you have little children, buy term life insurance. Most people don't come to me for life insurance except when they shouldn't be buying life insurance. It'll be older people who are trying to buy life insurance. It's young people with little children, or depending on however old you are. But if you have little children, those are the people who need life insurance most. Again, regarding any of this stuff, call me. Um, Most people get their insurance through their employer, or cover their whole family through their employer. Getting your own coverage through your employer, especially the larger your employer is, usually makes a lot of sense. The larger your tax filing household is, and the lower your income, the more government assistance you can get. So getting your health insurance through your employer, if it's your employer, usually does make sense. The larger the employer, usually the better sense it makes. The more wealthy you are, usually the more sense it makes. Um, Oftentimes, it doesn't make sense to get health insurance for your kids or your spouse that way, but people are used to doing it that way, and they don't know the options. Again, talk to an insurance agent. Student coverage. A lot of universities and colleges offer student coverage dirt cheap. I mean, we're talking, the cost is often the amount you would pay for 1 month for either a semester or a whole year. So if that's available to you, take a look at it. Um, so this is healthcare.gov. In California, we have our own marketplace called Covered California. States that don't have their own marketplace use healthcare.gov. There's a lot of information on here. Uh, Again, this is not complete information. Talk to an agent, talk to somebody, because no matter how much you study, you're not, you just aren't. California is different, so the open enrollment December 15th doesn't apply to us. There's a lot of state specific things. I am only licensed in California. If you need to talk to an insurance agent, talk to somebody licensed in your state. In California, you know, I'm available. So please feel free to ask. But this is the marketplace, and each state either has its own marketplace, or it uses what's called the federally facilitated marketplace, which is healthcare.gov. Now, as far as Medicare, Medicare.gov is a great website, but let me assure you, do not try to navigate Medicare by yourself. Um, as it's it's a huge mistake. I have seen so many people do it. Making the wrong choice with regard to Medicare can cost you certainly thousands of dollars. It can be tens of thousands of dollars. Um, and it's incredibly complex. It's so complex. my little introduction that I used to do for seminars uh, was just a bare basic educational thing for getting started with Medicare was half an hour long. And I'm not joking when I tell you, if you are looking, if you are possibly going to get Medicare, if you are qualified for Medicare, if you have Medicare, you should talk to an insurance agent every single November. Do it. You need to talk to an insurance agent every single November, especially because the Medicare Advantage plans change from year to year, and the Part D, as in drug, prescription drug plans change from year to year. I couldn't even start explaining Medicare in a short time. Um, Medicaid in California is called Medi-Cal. So Medicare is for people who have been disabled for 2 years, have end-stage renal disease, or are 65 years and older. Medicaid is for people who have a low income. You can have both Medicare and Medicaid at the same time. In California, Medicaid is called Medi-Cal. Um, there's a lot of rules and regarding that. There's health insurance available, especially for children, through that, even for middle income people. Um, but those are certainly possible. Um, the number one choice people need to think about when they decide on their healthcare is whether they want a PPO and an HMO or an HMO. And a PPO is usually more expensive than an HMO. That doesn't mean that you necessarily want the PPO. I compare buying PPO insurance to driving a stick transmission on your car as opposed to an automatic. If you're the type of person who has a doctor you trust, goes to that doctor is your primary care physician, and you are going to continue going to that doctor. If anytime a specialist comes up, it's going to be your doctor telling you where to go, then an HMO is just as good for you as a PPO. A PPO, oftentimes, especially when you ask doctors will say, go PPO, go PPO. A, most of them have a financial stake in that. Even if it's unwitting, people generally go with their financial stake. Um, B, doctors themselves want to be in control of their healthcare in ways that most of us are not able to do. So if you ask professional race car drivers whether you should get an automatic transmission or a stick, they're going to tell you get a manual transmission, and they only drive manual. That doesn't mean that that's what's best for you. Um, if so, one of the most common things I hear from people is either I'm trying to get an appointment with a doctor, I'm trying to get to see a doctor, I'm trying to get tests done, and I can't do it, or I my doctor is constantly sending me to other doctors, sending me to tests all the time, and I don't want to take all these tests. Um, Almost always, that corresponds to having a PPO or an HMO. If you have a PPO, the doctors are getting paid per procedure. So every time you come in, the doctor gets paid. Doctor wants to see you more. Doctor wants more tests. They have a financial stake in that. With an HMO, the doctors get paid the same regardless of whether or not they see you, and they have to pay for your tests and things like that out of that amount that they get paid. So an HMO, if I've had clients come and tell me that they have an HMO and the doctors um, the doctor's ordering a ton of tests, that doctor is paying for those tests. They're not just sending you for no good reason. On a PPO, if the doctor says you don't need a test, you don't need a test. The doctor has a financial incentive for you to get the test. Also, as you get older and you need your doctors to talk to each other more, you have more medical records that need to be shared between doctors. Doctors need to talk about your medications. The, the better your results start getting from an HMO as opposed to a PPO, where you are the person who's keeping the doctors um informed about each other. Last thing I'm going to talk about, unless there are any questions, if anybody wants to actually put in questions in the chat right now, um, or I'm going to wrap this up, is that there are tax implications to your choices with healthcare. The tax code is heavily involved in your healthcare decisions and what you need about healthcare. Um, so the higher your income tax, the higher your tax bracket. There are special things like a high deductible plan with a health savings account that make more sense for people who have higher marginal income rates, people who have businesses. Also, if you're lower income and you're not receiving the government assistance, you could be receiving significant government assistance. Back in 2014, which was the first year of Covered California, I actually crunched the numbers, put all my clients into a spreadsheet, and my average client was receiving $700 a month of assistance. I have clients who are receiving well at that over $1,000 a month of assistance. It's available to you, uh, and you know I can only recommend you actually take advantage of it. Again, if you have questions, in the comments, and I don't know if I'm gonna keep this um, video up very long because it is really just I wanted people, I'm constantly counseling other people during open enrollment, and I wanted people in our community just to have some idea of what they should be looking at, what they should be thinking about regarding health insurance. Okay, wish you all the best. Shalom.